traps blending together, and then probably maybe one coming across, more specifically for the mid traps. Yeah, use Tuscan. Kind of right through there, right? And then you're going to pull them in that direction. So I'll do it just so you can feel, you can compare the two sides, okay? There.
You're not putting as much tension as you normally would with tabs?
Yeah, because otherwise it just tears right off as soon as you move the shoe. And you gotta use tough skin, so it's probably gonna slide off a little bit. But you're still getting those ripples, right? So you're still putting some tension. Okay, so relax there.
Does it feel flexible with this?
Yeah. It's not quite as good, but sometimes it does. Sometimes I'll combine them. Like if they're getting a lot of, like maybe this actually might be good for you on this side, because he's getting a lot of that kind of winging and flaring back here. So I would maybe put one of these just on that inferior angle to just kind of clamp that down a little bit more, and then this K-tape job on top, right? So combining them can work pretty well sometimes too, if you need to get that little, just that little bit extra, right? So I just kind of want you to be aware that that can be done. Okay. Let's move on from some of the scat stuff into a more structural job. The last one we'll show for today for the AC joint, right? So, spin around. So for AC joint injury, right, we know that it's the acromion and the clavicle where they meet, right? That's the AC joint. What typically happens is the clavicle will be driven upwards away from the acromion, right? So they split like that. This gets driven up, that stays down, and we have a separation of the joint this way, okay? Depending on the severity, grade 1, 2, or 3, right? The ligaments underneath have become disrupted. So our main strategy here is to just clamp that clavicle down and bring them back even again so they're flush, and allow the joint to have normal mechanics because they're aligned again, right? So the sooner you can do this to somebody who actually has an AC joint injury or an AC joint sprain, right, the better, okay? So if you see it happen like on field and you know that that's what it is, you've diagnosed an AC joint sprain, put this on immediately, try to, and clamp it back down. Because the longer this is sitting up away and the further apart they're disrupted and the longer it's allowed to stay like that, it's going to start to heal like that, right? So you see people with step deformities, right, from past AC joint injuries. That's because that's the way the joint healed. So it became disrupted and then it healed and it scarred back up in that malposition. And now you have terrible shoulder mechanics because the AC joint is in a terrible position, and you're going to have a lot of predisposition to early onset degenerative changes and who knows what else, because the shoulder doesn't work correctly anymore for the rest of this guy's life because he's healed like this. So if you can clamp that back down into a good position and think of it almost as like a cast, right? So you're going to want to leave that on as that joint heals again. It can help quite a bit. So we're just going to try to realign those from an external brace type support. Think of it as a cast. So if you're going to treat this person and you see it happen, and you can get that on there as soon as possible, and hopefully allow that joint to kind of scar up and heal up in a better position than this, right? Even if it's just a little bit, you may not get it completely flush again, right? But you can get better than without it, and that'll help the overall healing joint and his shoulder mechanics for the rest of his life, right? So, so you'd want to leave it on if it was your patient. You're going to keep applying this and try to leave it on and keep it on for probably maybe even 2 to 3 weeks, right, while that joint heals. You're going to have to probably reapply every few days or so, but that's fine because you're probably seeing them 2-3 times a week anyways, so every time they come to your office, just reapply it. Now you do have to warn your patient, like if this is for real an AC joint injury, it's going to be very uncomfortable, it's going to hurt while you apply it. So let's say he's out in the field, boom, he gets his shoulder jammed up, AC joint sprain, he's going to come run off the field, you're checking him out, you rule out everything else that may be more serious or dangerous, it's an AC joint sprain, I'm going to clamp this down for you. So I palpate the acromion and the clavicle, I can feel the joint line kind of right in there. So I'm going to put this on the joint line, shaded towards the clavicular half because it's the clavicle that we're trying to lock back down. I don't want it just on the clavicle though, I want it to overlap the joint. So his joint line is right there, so I'm going to put it kind of about right there for him. Okay, slightly towards the front too because I want to be able to grab that clavicle. When I put this second strip on, if this were a real injury, it's going to hurt, right? But
It's sprained.
it's sprained and it's disrupted the joint space slightly, right? Or maybe a lot, and I'm pushing it back down together. So it's going to hurt while you do it. But then it's going to, so then you tell them, okay, I'm going to put this on, it's going to hurt, right? It's going to feel uncomfortable, but give it like a few minutes, like 5-10 minutes, and we'll just relax here with this on. Then it's going to actually start feeling a lot better once that initial like shock of pushing it back into place is over and they get a chance to calm down for a few minutes. Then it will actually start to be very relieving because the joint's in a much happier place, right? So we're coming here on our tab so I can grab that clavicle. Literally as much force as you possibly can. So I'm holding it down so it doesn't slide, and I'm just clamping that down. See, so it's a little uncomfortable even for a regular person, right? Or a non-injured person.
Regular.
Come on, speak loudly, Greg. Here.
So, what if, is any cutoff where someone has a grade 3 major separation? Are you going to do this? Or
Yeah, because what else are you going to do?
take them out of the game?
Well, yeah, they're not going to but to treat it, now I'm
Right.
just thinking treating purposes, you're going to sling it, right? You're going to maybe send them to the hospital or at least send them somewhere to take an x-ray to see what happened. As long as you're pretty positive that there's no fractures. So if you're suspecting there's some sort of clavicular fracture, then I'm not going to start strapping stuff down because then you can run into problems with that. But if I'm positive that it's just an AC separation and it looks pretty severe, if I'm unsure for any reason, let's get the x-ray first as soon as possible, and then if it's just the AC joint grade 3 sprain, then I'll put this on. But if I'm positive it's just the AC, then I'll put this on as soon as possible. Right? I'll usually do another one, kind of a little fanned orientation, just because we really want to make sure. So again, I'm going pretty much as hard as I can, and then it's there. In real life, when I do this, I will usually put the scap facilitation over the top of it. Right? Why?
Keep that down.
Just for overall shoulder mechanics, right? So a good scapular position helps everything in the shoulder. Everything. So if I have an injury to the shoulder, I'm trying to help correct it, why not just provide the good scapular mechanics at the same time just for overall joint health and performance, right? So put this on, I'm going to clamp that down. And plus the K-tape helps this to stay a lot. So like your first strip that you're coming down for